Hi, welcome to my today's classroom. In my today's classroom, I will be talking about non-alcoholic fatty liver diseases. Now, this non-alcoholic fatty liver disease, as the name suggests, it is not related to alcohol. Non-alcoholic fatty liver disease, short form is NAFLD. Non-alcoholic fatty liver disease is a wide spectrum of diseases in which it starts from simple hepatic steatosis to cirrhosis. In between lies NASH, that is NASH, non-alcoholic steatohepatitis, non-alcoholic steatohepatitis plus fibrosis, and at the end cirrhosis. Out of this, hepatic steatosis, hepatic steatosis can be reverted back to normal. Non-alcoholic steatohepatitis can be reverted back to normal with the treatment, but once patient develops non-alcoholic steatohepatitis and fibrosis plus cirrhosis, it will be difficult to revert back to normal. Ultimately, you will have to go for liver transplantation. So usually the patients of this non-alcoholic fatty liver diseases, they present with history of stretching sensation in right hypochondrium, in the right side of the abdomen, in right hypochondrium. Patient will present with anorexia. Patient will present with lethargy, weakness, hypersomnia. So these are the usual features of non-alcoholic fatty liver diseases. Now whenever a patient of non-alcoholic fatty liver disease reach to a physician or gastroenterologist, first of all, physician and gastroenterologist must look for metabolic syndrome, because this metabolic syndrome is related to the non-alcoholic fatty liver disease. If patient is having metabolic syndrome, then in those cases there are chances of developing non-alcoholic fatty liver disease. It may be steatohepatitis, it may be simple hepatic steatosis, it may be non-alcoholic steatohepatitis, it may be NASH plus fibrosis, or it may be cirrhosis. So whenever such patients are presenting wards and in hospital, first of all, rule out metabolic syndrome. In metabolic syndrome, the first thing is overweight. If a person is overweight, if a person is obese, if a person is having type 2 diabetes, if patient is having hypertension, if patient is having hypercholesterolemia, if patient is having hypertriglyceridemia, if thyroid profile is impaired, patient is having hypothyroidism, then these all are included in metabolic syndrome. So whenever metabolic syndrome is present, then chances of developing non-alcoholic fatty liver disease are more. If you want to label a patient as a case of non-alcoholic fatty liver disease, you will have to first rule out alcohol as the cause of chronic liver disease and other causes of chronic liver disease. If those other causes are not present, then in that case you can label it as a case of non-alcoholic fatty liver disease. If patient is having non-alcoholic fatty liver disease, and if he develops other liver diseases like hepatitis C or hepatitis B, then in those cases deterioration is fast. So whenever a patient is presenting with the non-alcoholic fatty liver disease, first rule out metabolic syndrome. Then on clinical examination, when we examine these patients, you will get enlarged liver on physical examination. If patient is having non-alcoholic steatohepatitis, he may present with jaundice even, and that jaundice may be of a mild variety. There may be distension of abdomen. It may be a gaseous distension of abdomen, and if patient is presenting with cirrhosis, there may be features of ascites. Patient may have features of portal hypertension like splenomegaly. I mean to say that all signs of cirrhosis are present in non-alcoholic fatty liver disease, NASH plus fibrosis, and in cirrhosis because of this non-alcoholic fatty liver disease. So whenever a patient is presenting with this non-alcoholic fatty liver disease, in investigations, first you go for ultrasound, simple ultrasound of abdomen, it is highly diagnostic. It is having 90% sensitivity, and it is the cheap test, and with the help of this you can diagnose non-alcoholic fatty liver disease. In ultrasound finding, there is collection of fat in the sonographic findings. Echo texture of liver is altered. So, a good sonologist can diagnose non-alcoholic fatty liver disease with the help of sonography. Apart from this, you can go for CT scan of whole abdomen. In CT scan of liver, you will get again findings of fat collection, you will get findings of fibrosis, you will get nodularity if there is development of cirrhosis. CT scan is little bit more costlier than sonography. MRI, which is more sensitive test, can be done. In MRI of liver, again you can demonstrate fat, you can demonstrate steatosis, you can demonstrate fibrosis. So again, it is a good diagnostic test, though it is more expensive. Nowadays, ultrasonographic elastase study is done, that is known as fibroscan. In this fibroscan, you can make out normal liver, you can make out fibrosis, you can make out steatosis. So this is how, with the help of fibroscan, you can make diagnosis. So these are the diagnostic intervention. These are the right diagnostic tests with the help of which we can diagnose non-alcoholic fatty liver disease. Apart from this, you will have to go for lab investigations. In lab investigations, SGOT level, SGPT level, this is usually done, and these both enzymes are raised. The ratio of SGP2 to SGOT is less than 1 or it is 1. In alcoholic liver disease, this ratio is more than 2. Apart from this, serum alkaline phosphatase may be raised in cases of non-alcoholic fatty liver disease. In chronic disease, in cirrhosis because of non-alcoholic fatty liver disease, or in NASH plus fibrosis, you can get low serum albumin levels, you can get low protein levels in the blood. So these are the investigations which are done in the case of non-alcoholic fatty liver disease. Even serum bilirubin is found to be raised in fatty liver disease if there is steatosis is more, fibrosis is more. So you will, in the lab investigations, you will have to go for serum bilirubin estimation, SGOT-PT level estimation. You should see the ratio of SGOT to SGPT, estimate serum alkaline phosphatase. Then there is the liver biopsy has little role in diagnosis of non-alcoholic fatty liver disease. It is not so much specific diagnosis. Still, some physicians and gastroenterologists, they do liver biopsy to diagnose this non-alcoholic fatty liver disease. So this is how we make diagnosis of non-alcoholic fatty liver disease. Once you have diagnosed a case as non-alcoholic fatty liver disease, then in that case, first of all in the treatment, you will ask patient to do lifestyle modification. You will ask patient to do exercise. You will ask patient to do relaxation exercise. These all exercises and diet control can control the overweight of the patient, can control the increase in the waist circumference of that patient, can control the basic metabolic rate of that person. So the lifestyle modification and diet control is very helpful in non-alcoholic fatty liver diseases. Then in the case, if patient is having systemic hypertension, control that systemic hypertension. If patient's thyroid profile is impaired, then you will have to control that thyroid profile. If patient's lipid profile is impaired, then in that case you have to treat that lipid profile. Usually in these cases, patient may have hypertriglyceridemia, hypercholesterolemia, HDL level is found to be low. So you have to control this dyslipidemia with the drugs like atorvastatin, rosuvastatin. These drugs are effective in controlling this dyslipidemia. So you control dyslipidemia, control thyroid, control hypertension, control diabetes. Diabetes can be controlled with the help of oral hypoglycemic drugs. So you control the diabetes, advise patient to do lifestyle modification exercises, diet restriction, diet modification. So like this, we can treat a patient of non-alcoholic fatty liver disease. Once the patient has developed NASH and fibrosis, with the help of lifestyle modification and other treatment, you can revert back the non-alcoholic fatty liver disease to normal up to the stage of NASH. But once patient has developed NASH and fibrosis, then it will be difficult to revert it back to the normal. In that case, you will have to give drugs which are given in the case of chronic liver diseases. If patient has developed cirrhosis or chronic liver disease, that is NASH plus fibrosis, then in those cases you will start with ursodeoxycholic acid twice a day, at least twice to thrice a day. Plus, if there are other complications of chronic liver disease, then you will have to manage it in the same way as the case of chronic liver disease. As in the other cases of chronic liver disease, management is almost the same, only with the help of lifestyle modification, diet restriction, control of diabetes, control of overweight, control of obesity, control of cholesterol, control of hypertriglyceridemia. With the help of this, you can revert back the stage of NASH to normal. You can revert back the stage of simple steatosis to normal, but not fibrosis and cirrhosis to normal. So overall, prognosis is good if patient is having only simple hepatic steatosis or non-alcoholic steatohepatitis, then prognosis is good. But if patient develops fibrosis with NASH and cirrhosis, then prognosis is guarded. So this is all about non-alcoholic fatty liver disease. Thank you.